Hello everyone. Let us discuss the topic drug delivery and methods.
What is a drug? Any substance that is used to prevent, diagnose, treat, or relieve symptoms of a disease or abnormal condition. Drug can also affect how the brain and the rest of the body work and cause the changes in mood, awareness, thoughts, feelings, or behavior. The route of drug administration is simply defined as the path by which a drug is delivered into the body for diagnosis, prevention, cure, or treatment of various diseases and disorders. The route of drug delivery are classified as local delivery and systemic delivery. Drug administered by this route enters the blood and produces systemic effect. Classification of various routes of systemic drug administration are enteral delivery and parenteral delivery. Enteral route involves absorption of the drug via the gastrointestinal tract, includes oral delivery, sublingual, and rectal delivery. Parenteral route, on the other hand, refers to any routes of administration that do not involve drug absorption via the gastrointestinal tract, including inhalation, injection, and transdermal. Local delivery. The local route is the simplest mode of administration of a drug at the site where the desired action is required. Systemic delivery. When the systemic absorption of a drug is desired, medications are usually administered by two main routes, the enteral route and the parenteral route. Let us discuss systemic route of administration in detail. First is the enteral route. Enteral administration is food or drug administration via the human gastrointestinal tract. Enteral administration involves the esophagus, stomach, and small and large intestines, that is, the gastrointestinal tract. Method of administration includes oral, sublingual, and rectal. The first subdivision of enteral delivery involves the oral delivery. Oral administration is a route of administration where a substance is taken through the mouth. Many medications are taken orally because they are intended to have a systemic effect reaching different parts of the body via the bloodstream. Dosage forms are tablets, capsules, syrups, mixtures, etc. This oral drug route of administration passes the first pass effect. What is a first pass effect? The first pass effect, also known as first pass metabolism or pre-systemic metabolism, is a phenomenon of drug metabolism whereby the concentration of a drug, specifically when administered orally, is greatly reduced before it reaches the systemic circulation. The second subdivision of enteral route is the sublingual delivery. The sublingual route is one of the early modes of administration for the systemic drug delivery. This route avoids first pass metabolism and affords quick drug entry into the systemic circulation. The third subdivision of the enteral delivery is the rectal delivery. Drug delivery via the rectum is a useful alternative route of administration to the oral route of patients who cannot swallow. Traditional rectal dosage forms have been historically used for localized treatments, including delivery of laxatives, treatment of hemorrhoids, and for delivery of antipyretics. The second subdivision of the systemic delivery is the parenteral delivery, which involves inhalation, injection, and transdermal. The first subdivision of the parenteral delivery is inhalation. Pulmonary drug delivery is a developing technology in which medication is inhaled through the lungs and enters the bloodstream through the alveolar epithelium. Pulmonary drug delivery provides a non-invasive alternative method to subcutaneous injection and also intravenous injection. Nebulizer is the drug delivery device that is used for drug administration into the lungs in inhaled mist form. Many respiratory designs and disorders like asthma and cystic fibrosis can be treated by this approach. The second subdivision of parenteral route of delivery is injection. Injections are among the most common healthcare procedures throughout the world, with at least 16 billion administered in developing and transitional countries each year. Types of injection: subcutaneous, intramuscular, intravenous, intraperitoneal, intradermal, intramedullary, intrathecal, intra-articular, intracardiac, and intra-arterial. Subcutaneous. The drug is dissolved in a small volume of vehicles and injected beneath the skin from where the absorption is slow and uniform. Method is useful when continuous presence of the drug in the tissue is needed over a long period. Tissue, thigh, abdomen and arm. Example, adrenaline and insulin. Substance causing irritation to the tissue should not be injected, otherwise they will cause pain and necrosis at the site of injection. Intramuscular. Injection is made deep into the muscle tissue. In humans, the best site is the deltoid muscle in the shoulder or the gluteus muscle in the buttocks. This method is suitable for irritating substance that cannot be given by subcutaneous route. The speed of absorption from site of injection is dependent on the vehicle used. Absorption is quick from aqueous solution and slow for oily preparations. Absorption is complete, predictable, and faster than subcutaneous route. Intravenous. Drug solution is injected directly into the lumen of a vein so that it is diluted into the venous blood. The drug is carried to the heart and circulated to the tissues. Drug in oily vehicle or those that causes hemolysis should not be given by this route. This route is of prime importance in emergency. However, there is a certain disadvantage of this procedure. Once the drug is injected, nothing can be done to prevent its action. IV injection requires technical skill to minimize risk of leakage of irritant solution into the surrounding tissue. Air embolism may cause serious problems. Intraperitoneal. The peritoneum offers a large absorbing surface area from which drugs enter circulation rapidly but primarily by way of portal vein. Widely used route of drug administration in laboratory animals. In humans, it is very rarely employed due to the dangers of infection and injury to viscera and blood vessels. Intramedullary. The needle is introduced into bone marrow cavity. This route is used when veins are not available, especially in children. Intradermal. Drugs are injected into the papillary layer of skin. For example, tubercle injection for Montauk's active test and vaccination for immunization against tuberculosis. Intraarterial. Sometimes a drug is injected directly into an artery to localize its effect in a particular tissue or organ. However, the therapeutic value of such practice is doubtful. Intrathecal. Blood-brain barrier often prevents the entry of certain drugs into the central nervous system. Intra-articular. It is also known as the intrasynovial. Sometimes drugs are injected into the joint cavity to localize their action at the site of administration. The topical dosage forms includes skin, eye or ear, nose and lungs. Under skin, creams, ointments, lotions, gels, transdermal patches and discs are used. Transdermal dosage. The drug is administered in the form of patch or ointment that delivers the drug into the circulation for systemic effect, absorption of drug through skin, ear or eye. Solutions, suspensions and ointments are used. For nose and lungs, sprays and powder are being used.